Especially during the pandemic, we have to be prepared for anything. As every day in EMS, we could get something as simple as an ankle sprain in the rec center to a influenza-like patient who needs to be transported to the hospital. So really, we have our protocols to follow, and we have to come there and provide the best care that we can.
Normally, move-in weekend, that's usually one of our busier days, but the school's done a really good job actually spacing out the people who are moving in. So we've had fewer people on campus every day, and so I think we've gotten fewer calls than we normally would for this time of year, so we're always happy about that.
My first hand with experience with COVID, that was a very scary experience, because it's a deadly virus, and at the end of the day, I don't want to bring that back to my family. I don't want to bring that back to my home, to my friends. So it was a very scary experience. And I made sure to, have all the necessary precautions, full isolation suit. Even though I wore all that, it was a very scary experience. And I was right there. I was helping the patient onto the ambulance. I was taking their vitals, and I was very close to the patient. But I had to be, right. And I made sure to not compromise the care that I can give.
I were talking about a year ago, a patient at the health center who I got called for because they had a cough and a fever. That was a normal day for us. We get those calls pretty often. We bring them over to the hospital so they can be evaluated. Those are the kinds of things that we can do with our eyes closed because we do them so often. But now you look at those kinds of patients with new eyes where you're worried much more about things that I wouldn't have been normally. I haven't been visiting my family. I'm from Massachusetts originally, and the travel restrictions and the fact that I'm working in a higher risk environment, in a healthcare environment, means that I don't want to go home and see my family and potentially get them sick. At this point, I've reached a kind of state of acceptance where I'm doing the best I can to keep myself safe, and if it happens, it's going to be really unpleasant, but if it happens, it happens. I think at this point, I'm more worried about getting sick, not realizing it, and then getting someone else sick. That's been my biggest stressor right now, so looking out for other people has made me be much more careful.
It's hard to see families go through the whole COVID-19 pandemic. One of the calls that I had gone on during the pandemic, this was recently where I went to the patient's home, and it was a cardiac arrest, and we could not save the patient. He was a 50-year-old man, and he had 2 teenage boys and a wife, and by the end of that call, the boys didn't have a father and the wife didn't have a husband. So it's kind of hard to see things like that. There's definitely a lot of emotions because you're going to see a lot of different things that you normally wouldn't see. You're going to see a lot of traumatic things. You see people at what could be one of the worst days in their life, and when you're there during those moments, of course you're sort of wrapped up in the emotions there, and it's always important to consider yourself and be like, yeah, listen, I know this person is going through this, but I need to do the best that I can. So you also have to sort of take a step back and remember that you're a provider and that you need to perform the best care, what you've been taught to do.